walk. Hello, teacher. Hello, Ardaksh. How are you, teacher?
I'm good, you are good too.
I'm good too, thank you. I have another question about teeth whitening. Of course, go ahead. What do we need to do to maintain the whiteness after the teeth whitening procedure?
Arda, the most important thing after the teeth whitening procedure is that we need to stay away from colored foods, or rather, drinks, for 48 hours. What are these? For example, cola, red wine, pomegranate juice, you name it. If we don't stay away from colored drinks like this and consume them frequently right after the whitening procedure, we would essentially waste the whitening treatment a bit. So, after the whitening procedure, we definitely need to avoid smoking and tobacco products. We need to be careful for up to 48 hours. Can we do everything after 48 hours? No. We should limit the number of drinks we consume a bit more. Also, for example, a week has passed. We drank a lot of tea and coffee. You may need to brush your teeth once in a while with a whitening toothpaste recommended by your doctor. We want to continue by reducing our old habits as much as possible, following what we call a white diet, which means avoiding drinks and foods that would leave stains and marks on a white surface, like saucy dishes, and also reducing our daily habits like tobacco and smoking, as we mentioned earlier.
Teacher, you listed the things we shouldn't consume, especially within those 48 hours. But should we still maintain our regular oral hygiene routine?
Of course. We never neglect our oral hygiene. After you whiten your teeth, your doctor will recommend special toothpastes that are suitable for whitening. He will ask you to use them for a while. Also, whitening was done for you in the office, and a whitening procedure was performed at the clinic. To maintain the effectiveness of this whitening and ensure it lasts longer, you might also consider continuing with at-home whitening treatments. So, this is your doctor's decision, and it can be evaluated accordingly. But the most important thing is to stay away from colorful foods for a while. So, choice of toothpaste is also very important. Sometimes we whiten our patients' teeth and send them off. For example, sensitivity-relieving toothpastes can cause discoloration on the teeth. So, if a sensitivity-relieving toothpaste is continued after the whitening procedure, it can resist the whitening of the teeth. For example, this is something that needs to be taken into consideration. So, we'll have your whitening procedure done. You will stay away from colorful foods carefully for a couple of days. You will reduce your smoking as much as possible, or we will use mouthpieces sold in pharmacies for the cigarettes. And then, when your doctor calls you to the clinic, after a week or two, they will do a checkup. We will identify where you made mistakes, and maybe your toothpaste will be changed, or perhaps another round of whitening will be done. In this way, we will transition back to normal life in a controlled manner. But if I say that I whitened my teeth and then drink tons of cola, tea, or coffee, apparently that's the case. If we go down this path, our teeth whitening will revert in a very short time. Also, after the teeth whitening procedure, around 6 months to a year, a repeat procedure may be necessary.
Doctor, thank you very much for the valuable information you provided.
You're welcome, my dear Arda. Don't forget to subscribe to our channel and follow us. Looking forward to seeing you.